Hello everyone! Welcome back to PhysioTechs. In today's video, we're diving deep into a common but often misunderstood condition, sciatica. Whether you're dealing with pain radiating down your leg or just curious about it, we've got you covered. But before we jump in, if you're new here, don't forget to like, share, subscribe, and hit the bell icon for the latest updates from PhysioTechs. Let's get into it. So, what is sciatica? Sciatica refers to pain that radiates along the path of the sciatic nerve, which runs from your lower back, through your hips and buttocks, and down each leg. It's actually a symptom rather than a condition itself, typically caused by compression or irritation of the sciatic nerve roots in the lower spine. Common culprits include herniated discs, spinal stenosis, degenerative disc disease, or even muscle spasms in the buttocks, known as Piriformis syndrome. Now, let's talk symptoms. Sciatica often presents as pain in the lower back, buttock, and down the back of one leg. You might also experience numbness, tingling, or weakness, making it hard to move your leg or foot. The pain can range from a dull ache to a sharp burning sensation, often worsened by prolonged sitting, sneezing, or coughing. Certain activities can aggravate or relieve sciatica. Sitting for long periods, bending forward, or lifting heavy objects can make things worse. On the flip side, changing positions frequently, walking, or lying down with a pillow between your knees can provide some relief. Diagnosing sciatica involves a clinical assessment, where a healthcare provider checks your strength, reflexes, and sensation in your legs. Imaging tests like MRI or CT scans can help visualize the spine and pinpoint the problem. Sometimes an EMG is used to measure the electrical impulses produced by nerves and muscles. Now let's focus on treatment and rehabilitation through physiotherapy. Initial treatment often includes rest, ice or heat therapy, and over-the-counter pain medications. Physiotherapy, however, is pivotal. It involves stretching and strengthening exercises to improve flexibility and reduce pressure on the sciatic nerve. Manual therapies like spinal manipulation or mobilization can also help. Education on proper posture and lifting techniques is crucial to prevent future episodes. Here are some effective exercises to relieve sciatica pain. 1. Lie on your back, cross your right ankle over your left knee, and gently pull your left thigh towards your chest. Hold for 20-30 seconds, then switch sides. 1. Lie on your back, pull one knee toward your chest while keeping the other foot on the floor. Hold for 20-30 seconds, then switch sides. 1. Sit with legs extended, bend your right knee, place your foot outside your left knee, and twist your upper body to the right. Hold for 20-30 seconds, then switch sides. 1. Lie face down, push your chest upward while keeping your hips on the floor. Hold for 10 seconds, gradually increasing to 30 seconds. Repeat 5-10 times. 1. Start on hands and knees. Inhale and arch your back. Exhale and round your spine. Continue for 1-2 minutes. 1. Sit with legs extended. Reach forward to touch your toes. Hold for 20-30 seconds. 1. Lie on your back. Tighten your abdominal muscles and press your lower back into the floor. Hold for 5-10 seconds. Repeat 10-15 times. 1. Stand with one leg extended on a raised surface. Bend forward slightly and hold for 20-30 seconds. Switch legs. Remember to start slowly, avoid pushing into painful positions, and perform these exercises 2-3 times a day for the best results. Combine stretching with gentle walking to promote circulation. If you experience increased pain, stop and consult a healthcare provider. Thanks for watching. Stay connected and see you in the next video. Take care and goodbye.